much. A very good afternoon to one and all. Myself, Poonam Thakur, working at ANSH College of Nursing at Gwalior. And I'm thankful to BIMR fraternity as well as Principal Professor Suchita ma'am for providing me the opportunity to share my knowledge with you guys. So really, a very good afternoon once again to all my dear nightingales, those who are sitting in the classrooms and watching eagerly what's about to come. So cheer up, as tomorrow we are going to celebrate the World Health Day. So the theme for this year is My Health, My Right, as S.L. Desai sir has explained the things very nicely. So let me take a brief intro to that. World Health Day is the anniversary of World Health Organization, which we call WHO, which is observed and celebrated every year on the 7th of April. You can call it the birthday of WHO. Every year, WHO focuses on a specific public health concern and thus creating awareness across the globe. A brief history of WHO. The birthday was 1948 of WHO. Then campaign was started in 1955 to reduce malaria transmission. It began. Then 1958 till 1977 smallpox eradication program was done. In 1960, cholera and yellow fever disease control and eradication program was worked out. 1974, childhood immunization, and so on. Previous year, 2023, we had the theme Health for All campaign. And this year we are having My Health, My Right. So fasten your seat belts. Here I will take you through a small video by WHO. Hope you will like it. So enjoy yourself. It's getting worse.
Can't help you here. Can't help you now. Come back to next week.
Can someone please come on what's going on? You must be Ash.
Okay, so this was the short video which was created by WHO and uploaded on YouTube. So I took it from there to memorize the things that why they have planned My Health, My Right. As a previous speaker has also explained that it is our universal right to have the health, and 140 countries have constituted this thing in their law. And India is also having in Article 21, they have mentioned this thing that health is the fundamental right of everyone. The right of health includes entitlements such as the right to control one's health, informed consent, bodily integrity, participation in health-related decision-making. It also includes freedom, like freedom from torture, freedom from ill treatment, and harmful practices. So whatever country has done recently, everyone has heard about WHO has done this and that. But recently, India gets spread for future pandemics in 2023 December with one regional workshop on preparedness and resilience for emerging threats. Initiative was organized by WHO's Southeast Asia Regional Office on October 2023. Recently, Kochi in the Kerala has become the first city in India to be a member of World Health Organization, which was established in 2010 to connect cities, communities, and organizations worldwide to use a multi-sectoral approach to work collaboratively with older persons to create age-friendly physical and social environments for healthy and active aging. So this was about the World Health Organization. Now, talking about today's topic. First, I will discuss regarding patient's right. Being a patient is having the right to have informed consent, proper information about the disease condition, the treatment options, emergency care, about the records, affordable care, privacy, secondary opinion patient can have. It is not compulsory that he has to or she has to consult with one doctor only. Patient is having the right to go for the second opinion, dignity, grievance redressal. Somebody should be there to listen if they are getting some kind of fraud. Then rate card should be displayed at hospitals. Further, information about your treatment. One of the right is information about your treatment and informed consent. Patients have the right to receive clear and understandable information about their diagnosis, what they are suffering with, treatment options, what options are available, whether they have to take only medicines, they have to go for the surgery, or with medicines the disease condition can be resolved, potential risk and benefits, and other alternatives too. Information regarding same should be communicated in a manner that respect the patient's preference, cultural background, and level of understanding. We, the nurses, are the backbone of healthcare delivery system. So it is our prime responsibility to maintain proper communication with our clients, with our patients. We should explain the information to the client in their preferred language. Now, what is informed consent? It is made up of two words. Informed. Informed means you have already informed about something. Consent, to take permission. It is the process of communication between a patient and physician, or you can say the healthcare team, that result in patient's authorization of agreement to undergo a specific medical intervention. This is according to American Medical Association. If healthcare team is failed to obtain informed consent, it renders any physician liable for negligence or battery and constitutes medical malpractice. Informed consent is not just a sign on the paper. It is the process through which patients are provided with relevant information about their treatment, options, and voluntarily agree to a proposed course of action. It's more than just a signature. It is based on the principles of autonomy. Autonomy, right to make decisions according to their own beliefs or preference, and respect for the individual's right to make decisions about their own health care. Many of us has been visited the hospital, and if someone is going through the surgery, so they are supposed to sign a paper. Generally, maybe many of the students have observed this situation with the relatives or with near and dear ones. So the team at reception somewhere, we used to get the consent, and they asked, just sign the paper. And somebody used to sign, like a patient or the family member of the patient. We will discuss further who can give the informed consent. So they just sign the papers, and the particular procedure has been started, like surgery, if they are going through any surgery, or cesarean section if we talk about. So whether they have explained the things, what is written in the form, it is a kind of blanket type of form. Already everything is mentioned, yes or no, or simply sometimes they ask, only put your signature. That is called consent. So it is the mentality of many of the people or community background that consent means to put your signature on a paper. But it is not like that. It is not just putting your signature without getting the information what is going to happen. Agar hum ye karwate hain, if this is going to conduct, then what will be the risk? What will be the benefits? What complications can be arised? We are having the right to know this all things from the healthcare facility. and we can change our mind also. It is the right of patient. It is not like that once you have put your signature on the consent and they have changed the procedure or changed the location of surgery or whatever they have done, so they can do. They have to inform you again, because it is a process. It is not one time stop center that once you have put your signature and now things are done. एक बार sign कर दिया, that's it, हो गया, consent दे दिया. It's not like that. It is patient's right to know about the things related to his medical condition. So what are the components of informed consent? Here we will discuss the 5 components of informed consent. कि एक consent को informed or liable legal होने के लिए what all things are necessary. The first one is the competence, disclosure, understanding, voluntariness, and then last stage is providing the consent. In the small picture, you can see that one person is providing information to another person, then another person is exchanging the ideas. Yes, I understand. That is the meaning of informed consent. It is not like that. I have explained to my patient कि नहीं, okay, take one example. It is a full-term delivery is going to happen. Patient is coming to your hospital. You are the sister in charge over there. You are taking care of the patient. और आपने सिंपली बोल दिया कि चलो गेट रेडी, नॉर्मल नहीं हो पाएगा, सिजेरियन सेक्शन के लिए जाना पड़ेगा, और अभी टाइम नहीं है, बहुत जल्दी जल्दी करना पड़ेगा. So it is not that kind of information. आपने मदर को पूछा ही नहीं, आपने बस one type communication कर दिया. आपको जो बोलना था, you said those things. मदर को अंडरस्टैंड हुआ नहीं हुआ, उसके फैमिली मेंबर्स को समझ में आया नहीं आया, बट यू डिड नॉट आस्क. जब तक पेशेंट नहीं बोलता यस आई अंडरस्टैंड द थिंग्स व्हाट आर गोइंग टू बी डन, इस सर्जरी का क्या बेनिफिट हो सकता है, मेरी बॉडी को क्या रिस्क है, व्हाई आई हैव टू गो फॉर सर्जरी ओनली, वी हैव टू एक्सप्लेन ऑल द थिंग्स. सो फर्स्ट वी विल सी द competence. Competence means a person has the ability to make and be held for the decisions. Okay. First of all, informed consent में जो आपका patient है, it should be competent enough. Means the patient should be having the decision making capacity. If we talk about the children, like 5-year-old बच्चा है, उसका कोई procedure होना है, maybe कोई surgery होना है because of the medical condition, you cannot ask to the child, yes, do you understand? Do you agree for the procedure? Okay, these are the consequences. No, you cannot take the competence because the child is not capable to understand all the things. He cannot measure the benefits, risk, or suppose a person who is not disoriented, mentally ill patient, he is not competent enough to provide the consent, to understand the things properly. Means the patient should have the decision making capacity first. Only that patient can provide the informed consent. Ability to understand the options, whatever you are explaining to the patient, patient को वो समझ में आना चाहिए कि what we are explaining, he should get the things. Consequence of the options, understand the benefits, the risk of the options. If the patient is not able, for example, if it is a child, if mentally retarded patient, तो उस केस में we can take the consent from the surrogate decision maker. Surrogate decision makers वो होते हैं those like legal guardians or parents of the child. They can provide the informed consent. Or in case of like mental illness patient is there, or who is not stable or traumatized patient, so uske family members can provide the informed consent. So you have to inform all the terms and conditions, all the options, risk, benefit of the particular procedure to that surrogate decision maker. आपको उसको explain करना है, then you can take. So the very clear point is that the patient should be competent enough to understand the things related to the procedure. Second one is disclosure. The term itself says disclosure means nothing to hide. Before taking consent, healthcare provider must disclose relevant information about the proposed treatment, its purpose, क्यों ये treatment किया जा रहा है, potential risk, इसको करने से risk भी हो सकता है या क्या risk है, we have to disclose. What are the benefits of choosing this type of line of treatment? then likelihood of success. कई बार कैंसर की सर्जरीज होती हैं, so doctor used to discuss with the patient, we are having 30% success rate in particular surgery, then let the patient think whether he or she wants to undergo the surgery or not. We cannot pressurize, नहीं नहीं आपको तो कराना ही पड़ेगा. We have to explain the benefits also but risk also. इसका success rate इतना है, so let the patient has the right to think and take the decision. And any alternatives, yes, आप ये सर्जरी नहीं करवाएंगे but you can go for this medical treatment, you can take the medicines but medicines will take longer time to heal. You have to explain the positive and negative both aspects of any treatment facility to the patient. We are not supposed to hide anything कि risk छुपा लिया, benefit दिखा दिया, बस that's not it. The third point is understanding. The same, I have explained everything to you. As you are listening to me, I am just speaking, I am talking, you are listening to me. But I'm not asking whether you are understanding or not. What I am teaching to you, you are getting the points, what we have to do. So in case of informed consent, it is two-way communication between the healthcare provider team and the client. So what we are explaining, patient must understand the information prior to consent. His or her queries must be clarified or additional information related to medical condition can be provided. For example, you are explaining about the normal vaginal delivery. You are explaining the benefits. Yes, इसके ये benefits हैं, body easily recover होगा. You can, मतलब currently you can achieve that, you can walk in very short period. There will be no restriction on feeding as well to the baby. Then you are explaining the some of the negative aspects of cesarean section also, but you are supposed to explain the things when and what conditions cesarean can be done if the situation is not controllable in normal vaginal birth. There are some conditions in which normal delivery is not possible, and if it is possible in your particular client's case, then you should not forget to explain about episiotomy as well. Normal delivery होती है, बहुत अच्छी होती है, that is one point. What we are supposed to explain the episiotomy also to our client कि हाँ episiotomy जो है 80% cases में episiotomy is required, करना पड़ता है, तो उसके लिए क्या conditions रहते हैं, how we used to do episiotomy. So these all things we have to explain. And if your client asks, okay, अच्छा मुझे नहीं पता, मुझे episiotomy, suppose patient ने बोल दिया अच्छा episiotomy होता है, मुझे नहीं कराना, I will go for cesarean section. Nowadays these cases are coming a lot to the clinics. In the OPDs, I used to discuss with a lot of the clients. अच्छा episiotomy होता है, तो उनको डराना भी नहीं है, but you have to explain it calmly. The benefits क्या है, risk क्या हो सकते हैं, और patient का कोई भी doubt है, then we have to clear that doubt with our rationals. And if additional information needed by the patient, then we should provide related to the medical condition. Fourth one is the voluntariness. In the picture, you can see doctor is running behind the client, taking injection in the hand. So patient must be free from any pressure, influence while making decision about their treatment. किसी भी तरह का प्रेशराइजेशन नहीं करना है कि नहीं आप तो अभी डिसाइड कर लीजिए, टुमारो आएंगे तो हम मिलेंगे नहीं आपको, आपका ये सर्जरी और डिले हो जाएगा. We should not maintain such kind of pressure on the patient. It is patient's right as well. We are talking about the rights ना, patient का right है ये. He can take the time to think upon, to take the decision. We should not influence the patient also कि नहीं मैंने जितनी भी सर्जरीज करी ना सब बहुत अच्छी हुई हैं. You can come and patient is having the right to go for second opinion as well. If he or she is not satisfied, they should be given opportunity to ask questions, seek further information, and take time to consider their options. So we should not force or pressurize the client. It void the rule of informed consent. Now, ये सब कंप्लीट करने के बाद, प्रॉपर एक्सप्लेनेशन के बाद, पेशेंट को अंडरस्टैंड होने के बाद, वॉलंटरी एग्री होने के बाद, उसके बाद वी शुड रीच द पॉइंट ऑफ कंसेंट. Patient give their consent to a treatment plan or procedure voluntarily based on a full understanding of the information provided. Consent can be expressed verbally, बोल के भी consent लिया जा सकता है. You can record, because recording is again a very important point. In writing, For example, many of the hospitals used to have their consent forms already in the typed pattern. Then they can fill the columns according to the choice and put their signature, or implied through actions also. अच्छा, फॉर एग्जाम्पल हमें कभी सर्दी जुकाम या सम काइंड ऐसा कुछ हो जाता है छोटा मोटा, तो वायरल हो गया, तो हम पेशेंट क्लिनिशियन को दिखाने के लिए गए, डॉक्टर के पास गए, उसके लिए कोई कंसेंट नहीं देना पड़ता. दैट इज कॉल्ड इम्प्लाइड कंसेंट. मींस वी जस्ट वेंट फॉर द जनरल चेकअप के लिए गए, या फिर हम अपना ब्लड सैंपल देने जाते हैं. दैट इज कॉल्ड इम्प्लाइड कंसेंट. मींस डॉक्टर इज एग्री दैट आप अपने वॉलंटरी से ही खुद के चेकअप कराने के लिए आए हैं. बट हाँ, अगेन इफ यू नीड एनी इन्वेजिव प्रोसीजर, कोई प्रोसीजर कराना पड़ता है आपको, या कोई सर्जरी के लिए आगे रिकमेंड किया जाता है, या डायग्नोसिस के लिए कोई लाइक एमनियोसेंटेसिस ये सब करना पड़ता है, देन वी हैव टू गो फॉर द इन्फॉर्म्ड कंसेंट. So here majorly two types of consent are there: informed consent and implied consent. Informed consent is one what we were discussing about, कि उसमें physician या nursing staff, healthcare जो team है, it takes proper permission before procedure, test or exams. In this, risk and benefits both are explained to the patient before conducting any procedure. And risk and benefits are based on the recent evidence-based research as well. Consent is either given by patient or consent is not given, means denied. Patient ने मना कर दिया, no, I'm not agreeing. So physician respect patient's autonomy. ये भी patient का right है to accept the consent or to deny. I don't want to go for this particular procedure. मुझे नहीं करना sign. So we have to respect that also. पीछे नहीं पड़ जाना है, force नहीं करना है. Implied consent में क्या होता है? Physician or nursing staff doesn't ask patient permission to perform procedure, test or exam. बिना permission के ही आपने test कर दिया. Patient is not provided with the risk or benefits of the procedure. जो information है, that is not based on the recent practice going on. Physician sometimes may not respect the patient's autonomy. So if you are going for any surgical procedures, then implied consent is not fruitful for that, because in future, if any problem arises, then it can consider the harm to the physician and the whole healthcare team as well. Exceptions to informed consent. कहाँ पर informed consent में exception है, overruled किया जाता है? In case of emergency, urgent or life-threatening situation. Suppose roadside accident हो गया, emergency department में case आ गया, so आपको पहले consent के लिए नहीं दौड़ना है. First you have to stabilize the condition of the patient, because this is the exceptional case. In case of life-threatening conditions, emergency conditions, first we have to stabilize the patient. Then consent can be taken as soon as patient's condition stabilizes. या फिर उसका कोई फैमिली मेंबर, सरोगेट डिसीजन मेकर अगर वहां पहुंच जाता है, देन यू कैन टेक द कंसेंट फ्रॉम दैट सरोगेट डिसीजन मेकर एज वेल. नेक्स्ट एक्सेप्शन इज incapacity. Consent can be obtained from surrogate decision makers. Incapacity means patient is not capable to think, patient is not mentally well, or children below the age of 18. In Indian Constitution, we consider the valid consent from children 18 years and above. Below 18s are not considered for informed consent. Yet, you can take the informed permission from 16 to 18-year-old children. But that will not be called informed consent. Their family or their guardians, their parents, most specifically their parents, can provide the informed consent. So these are some of the exceptions. Now it's the time to exercise your brain. So in chat box, you can reply, okay? Say hi in chat box so I can see how many students are listening or they are sleeping, what they are doing. You can type in the chat box. I am just looking over there. Okay, Alka is there. Only one. Srashti, very good, very good, very good, bacha. Okay, so here comes a case study. Okay, listen carefully, everyone. A 64-year-old woman with multiple sclerosis is hospitalized. The team feels, healthcare jo team hai na, it feels she may need to be placed on a feeding tube soon to assure adequate nutrition. they ask the patient about this in the morning and she agrees. उन्होंने patient से पूछा morning में कि आपको feeding tube लगाना है तो हम लगा दें, या उसका बेनिफिट एक्सप्लेन कर दिया कि आपका शरीर बहुत कमजोर हो रहा है तो हमें इसको प्रॉपर न्यूट्रिशन के लिए आपको लगाना पड़ेगा, और उसने हाँ कर दिया. पेशेंट वाज एग्री. However, in the evening, before the tube has been placed, again patient becomes disoriented and seems confused about her decision to have the feeding tube placed. Evening में before going to procedure, once more health team will ask ना, आपको इस procedure के बारे में explain कर दिया था. तो that auntie, that client forgot. She was very confused कि कब बोला, okay, अच्छा ऐसा. She tells the team she doesn't want it in. उसने टीम को बताया कि मुझे नहीं डलवाना कुछ भी, मुझे नहीं चाहिए फीडिंग ट्यूब, मैं तो ऐसे ही ठीक हूँ. मोस्ट ऑफ द पेशेंट स्पेशली 64-year-old है, तो दे कैन रिएक्ट सच काइंड ऑफ बिहेवियर. दे रीविजिट द क्वेश्चन इन द मॉर्निंग अगेन. नेक्स्ट उस टाइम उन्होंने काम किया पेशेंट को, और नेक्स्ट मॉर्निंग में अगेन रिविजिट किया सेम क्वेश्चन. व्हेन द पेशेंट इज अगेन लूसिड, प्रॉपर सेंसेस में नहीं थी पेशेंट, अगेन उन्होंने पूछा, लूसिड थी, unable to recall her state of mind from the previous evening, the patient again agrees to the procedure. अब अगली मॉर्निंग में पूछा तो पेशेंट एग्री हो गई, हाँ ठीक है, you can insert the feeding tube. Now, is this patient competent to decide which preference should be honored? अब आप मुझे चैट बॉक्स में बताइए what we should do. क्या ये पेशेंट जो है कॉम्पिटेंट है इस प्रोसीजर के लिए? हमने बात की ना, इन्फॉर्म कंसेंट में कॉम्पिटेंसी होना चाहिए पेशेंट क्लाइंट के पास. तो ये जो पर्टिकुलर 64-year-old वुमेन है, whether she is competent to provide the informed consent, you can type your views in the chat box. Or you can unmute yourself also if the facility is available. You can talk also. Ankita Rajput and Shraddha, Unnati, Nandini. Okay, they have put hi and hello everywhere. So now tell me whether your client is competent. क्या वो इस लायक है कि informed consent दे सकता है? Yes or no, you can put in the chat box. जैसे hello type किया ना, yes, yes, she is competent, or no, no. Okay, you can type. Nobody is having the solution. Am I audible? Any of the teacher can tell me whether I'm audible now. Yes, I am audible because I can see you guys, those who are sitting. And in Pushpendra sir's class, I hope so. This is your teacher's name. So you can type the message in the chat box. ऐसे backbone कैसे बनेंगे healthcare system के if we will sit like this, huh? If we will not speak. Yes or no, something you can type. No, okay. एक बच्चा बोला है, that's good. Srashti. So put your hands together, clap for Srashti. सारे बच्चे जो पुष्पेंद्र सर की क्लास में बैठे हैं, they can put your hands together. I can see you guys. जल्दी जल्दी clap करो. Very good, very good. That's like my students. Very good, very good. Okay, no. Because patient is not fully oriented. Saxena sir is there. Thank you so much, sir, for participating. Okay, yes. Now we come to the condition actually. Yes. So this patient's underlying decision is impairing her decision-making capacity, as we can see, because she is changing her decisions. If her wishes are consistent during her lucid periods, this choice may be considered her real preference and followed accordingly. Because in the next day also she said yes. However, as her decision-making capacity is questionable, getting a surrogate decision maker involved can help determine what her real wishes are. आप पूरी तरह से 100% ट्रस्ट नहीं कर सकते हैं, सो वी हैव टू टेक द हेल्प ऑफ सरोगेट डिसीजन मेकर. कौन होगा सरोगेट डिसीजन मेकर? उनका कोई भी फैमिली मेंबर जो हॉस्पिटल में उनको अटेंड कर रहा है, he or she can act as the surrogate decision maker. Okay, now here is case 2. A 55-year-old man has a 3-month history of chest pain and fainting spells. बोल नहीं पा रहा अच्छे से. You feel his symptoms merit cardiac catheterization. You explain the risk, potential benefits to him, and include your assessment of his likely prognosis without the intervention. he is able to demonstrate, वो बता रहा है आपको पूरी तरह अच्छे से, उसका फेंटिंग स्पेल है, बोल नहीं पा रहा, but he can act and he can tell you, हाँ I understand all of this, but refuse the intervention, पर उसको ये नहीं कराना, कार्डियक कैथेटराइजेशन नहीं कराना है, वो इसके लिए मना कर रहा है. So can he do that legally, and should you leave it that, छोड़ दो उसको, नहीं कराना, नहीं कराना, चलो मना कर दिया, डिनाई कर दिया उसने. So what you should do? Think. What we can do in such case? Okay, let's see. This patient understands what is at stake with his treatment refusal. उस पेशेंट को अच्छे से वो समझ रहा है, वो बता रहा है हमें कि वो समझ गया है अगर नहीं कराएगा तो क्या क्या रिस्क हो सकते हैं, and he is competent to make this decision. You have a duty to respect his choice. However, you should also be sure to explore his reason. कारण भी जानना जरूरी है, why he is refusing the treatment, and continue to discuss your recommendations. आप further वहीं पे stop, full stop नहीं लगाना है. A treatment refusal should be honored, but it should also not be treated as the end of a discussion. आपको पता है कि उसकी हेल्थ को रिस्क है, तो आप वहीं पे रुकना नहीं है आपको. आप रीजंस पता करिए why patient is refusing in a proper channel of proper maintenance of the communication channel से आपको पता करना है, proper IPR maintain करना है, जो नर्सिंग स्टूडेंट्स को बताया जाता है how to maintain IPR with their client. You have to discuss with your healthcare team, you have to discuss with the physician that patient is not agree, you have to confirm the conditions, reasons क्या है, then you can again discuss the recommendation. And we should not stop at the end of discussion. It is an ongoing process. We should go on. So documentation, it is a very important part in the very first semester of nursing. It has been told that documentation is very necessary. Same in the case of informed consent also. Consent sign करा और उसको कहीं फाइल में रख के you left that like only. It is not like that, because I am pondering on the thing that it is not just a signature on the paper. When the discussion started, you have to mention the proper date and timing, with whom patient was there and what all the members were included in that discussion, because healthcare team will be there now. One of the role of nurse is nurse advocacy. So nurse will be involved in that session also, and all the stakeholders. Stakeholders means the persons, the organization or the person responsible, जो सब उस चीज में इन्वॉल्व है. Those can be affected. It can be the surrogate decision maker also हो सकता है साथ में. Physician will be there, patient will be there, the caring nurse will be there, nurse in charge will be there. So all the things need to be documented with proper date and timing. What information you have provided? आपने patient को क्या information दी है? Suppose you have explained about the surgical procedure. फिर how you provided the information? Oral information दिया आपने, या फिर you showed some kind of animated video? अच्छा, let me give you an example. Once I visited one eye hospital in Gwalior itself, and there a lot of screens were placed in that waiting area room. And most of the surgeries were being displayed on that screens. We can see how cataract operation is going on, and all the patients or their relatives, those who were sitting in the waiting area, they were watching those screens. So this kind of animated video also can be shown to the patient. ऐसे ऐसे आपका surgery होगा. Animated videos used to be there with the physicians. So these can be displayed. आपने वो दिखाया है, या फिर you have given any kind of handbook, booklet दिखाया patient को, and so forth. What thing you have used for the information provided, and what information you have provided, आपने क्या क्या explain किया है. Time taken for each session, there will be like 20 minutes, 15 minutes time you have taken, or 30 minutes also you have taken. So you have to mention that time also. Then question answers. If there were any queries raised by the client or surrogate decision maker, उसके companion से या फिर client ने कोई भी question या query arise की थी, if yes, then what answer you have provided? What was the rationale behind that question? It has to be mentioned over there. Decision communicated. क्या decision finalized हुआ? Whether the patient was agree for the particular procedure or not. Permission was granted or denied. Document the whole process. Then take signature on the consent. Patient's signature should be there. Then healthcare team, especially physician's signature will be there. Then one witness signature can be there on the consent form. So documentation is very important. We have to maintain these all things. It is not like that in case of any legal matter, if we will being a healthcare facility, we will say हाँ हमने बताया था, we have explained these things to the patient, उसने सुन ली थी, he or she understand also, but हमें नहीं पता फिर क्या हुआ. The court will ask, where are the papers of that informed consent? What was the documentation process? आपने क्या बताया था, किसने sign किया? Who is going to believe you? Nobody. So documentation plays very vital role. So you have to prepare the documentation related to informed consent as well. Invalid consent. कब consent को valid नहीं माना जाएगा? When it will be null and void? If it becomes invalid, if it is taken via force. आप कोई pressure से डरा करके patient को या फिर उसको time ही नहीं दिया सोचने का, you have explain नहीं किया है और आपने विदाउट प्रॉपर एक्सप्लेनेशन कंसेंट साइन करा लिया फोर्स के साथ, दैट इज इनवैलिड. वो इनवैलिड कंसेंट है. कंसेंट गिवन बाय, क्योंकि इफ यू हैव एक्सप्लेन तो आपके पास डॉक्यूमेंटेशन होगा. इफ यू आर नॉट एबल टू प्रोड्यूस द डॉक्यूमेंटेशन, it automatically considered as invalid consent. It is patient's right. He or she will tell if something happens na, they will stand in the court and they will say कि the team did not explain to us कि ये सर्जरी कराने से क्या होगा, उन्होंने पूछा ही नहीं, अपने मन से कर दिया. तो समटाइम्स जरूरी नहीं है, समटाइम्स ना पेशेंट साइड पे हो जाता है, उनको एक्सप्लेनेशन था बट at last उनका कोई loss है तो they can say. But if you are having, being a healthcare team, if we are having the proper documentation of the records, we can produce. Yes, we have consulted, we have conducted the session, we have explained the things like that. Consent given by intoxicated person, delirium person, disoriented person, that is also considered as invalid. जिसके पास is not capacity to think, to take the decision, उसका consent is not valid. By a person without mental capacity, by a person under 18 years of the age in India. Challenges of informed consent. ऐसा नहीं है, it is a very easy game. It is not like that. There are a lot of challenges. If we talk about the side of the team, इस healthcare team को क्या face करना पड़ सकता है? Poor communication. Sometimes patient is not open to the team. They did not speak too much. What we are explaining, they are not getting the points. Language barrier can be there, so we have to resolve the things. We have to work on that. Because it is not compulsory. If somebody is coming from the community area, they cannot understand this type what we are talking right now. If I explain the same things to the community people, it can be or it cannot be they understand the things. तो हमें उनके साथ according to their preference, उनकी language में we have to explain the things. Because हमने बोल दिया सर्जरी होना है, चलो सर्जरी फिर भी समझते हैं, कुछ लोग ऑपरेशन समझते हैं, सो वी हैव टू एक्सप्लेन. उनसे पूछना है आपको समझ में आया जो हमने बताया है, या फिर मेडिकल टर्मिनोलॉजी दे कैन नॉट अंडरस्टैंड इजीली. Lack of time to explain. As we can see, we are overburdened with the cases in the hospitals. So sometimes healthcare team does not find time to explain the things, because it can take half an hour also and 1 hour also sometimes to explain each and everything to the client. So कई बार lack of time की वजह से informed consent challenge में आ जाता है, simply sign करा लिया या फिर they also forgot. Not my responsibility. Healthcare team, when we work as a team, it is the accountability of each and every person of the team. Doctor is also accountable for that. That nurse is also accountable for that. Nurses should not think कि doctor का responsibility है, he is sitting on the high position, so doctors will take the informed consent, उनके ऊपर बात आएगी कुछ भी. No, it is not like that. Each and every person, those who were accountable for their patient's care, वो सब लोग उस healthcare team के सभी लोग जो है equally responsible हैं. Poor documentation. Documentation properly ना होना, time mention नहीं किया, भूल गए, date mention नहीं किया, session 3 हुए, but you have documented only 1 session. So poor documentation से challenge होता है informed consent. Patient side से क्या problems आती है? Anxiety and fear. Already patient is suffering with some kind of disease condition, और consent तब लिया जाता है when we are going for some invasive procedures, from major surgeries, from major diagnostic tests. So he can be anxiety, उसको tension है, डर भी होता है. Poor health and medication, कभी कभी health support नहीं करती है due to the effect of medications also. Mistrust. प्रॉपर ट्रस्ट नहीं होना हॉस्पिटल पे, स्पेशली काफी सारे हॉस्पिटल्स जो हैं their name or their trust speaks because 50% patient cures with the hospital facility itself. ये डॉक्टर का नाम सुनते ही आधा पेशेंट ठीक हो जाता है because he or she is putting full trust into that particular doctor. So mistrust can be the reason. Informed consent sign करने में challenge है एक illiteracy, चीजों को समझ नहीं पाना, अनपढ़ है अगर तो, and involvement of many family members. Sometime एक पेशेंट के साथ चार फैमिली मेंबर्स हैं, आप चारों को अलग अलग समझा के चारों अलग अलग दिमाग चला रहे हैं, नहीं नहीं यहाँ नहीं वहां कराओ, दूसरा बोला नहीं यहाँ नहीं वहां कराओ. सो पेशेंट इज ऑल्सो गेटिंग कंफ्यूज कि कहाँ से कराना है, सर्जरी कराना है कि नहीं कराना है. सो इन्वॉल्वमेंट ऑफ मेनी फैमिली मेंबर्स इज ऑल्सो अगेन अ चैलेंज टू साइन द इन्फॉर्म्ड कंसेंट. So finally, to conclude, the patient has a legal right to autonomy and self-determination under Section 21 of Indian Constitution. Yes, our India is also among under 140 countries. हमारे यहाँ भी Constitution में है the right to health. Patient के पास legal right है अपने आप choose करने का कि yes, I agree or I disagree. Consent obtained should be legally valid. Healthcare team who treats without valid consent will be liable under tort, that is civil law and criminal laws. Informed consent is an ongoing process that may involve ongoing communication between the patient and healthcare provider throughout the course of the treatment. एक बार साइन करा के पेपर फाइल में बंद करके रखने का, it is not a signature, it is an ongoing process. Patient should be kept informed of any changes to their treatment plan. अगर treatment plan में कोई भी change करती है healthcare team, so we are supposed to communicate those changes to the patient itself. Again हमें बताना पड़ेगा अगर हमने change किया है तो, and have the opportunity to reassess their preference and make informed decision accordingly. ऐसा नहीं कि आपने कल sign कर दिया, अब आज हमने change कर दिया कि surgery आज नहीं कल होगी, so we have to inform. और सर्जरी नहीं हो पाएगी, we have to inform. Then again we have to collect the informed consent because patient can change their opinion. It is their right. So this year WHO is talking about the my health, my right, my decision. Let me decide. Let me make choices. Yes, I want to go for that. और मुझे इसका भी एक बेनिफिट बताइए, अगर मैं ये ऑप्ट करूंगी तो मुझे उसका बेनिफिट बताइए. वी आर हैविंग द राइट, वी आर द कंज्यूमर्स. सो बीइंग अ पेशेंट, अगर हम पेशेंट है तो वी आर हैविंग द राइट. अगर हम हेल्थ केयर फैसिलिटी के जैसे बात करें यहाँ पे तो यस, पेशेंट इज हैविंग द राइट एंड वी शुड प्रोवाइड ऑल द इंफॉर्मेशन रिलेटेड टू द इन्फॉर्म्ड कंसेंट. इट इज अवर ड्यूटी. देन ओनली आवर पॉपुलेशन, आवर कंट्रीमैन विल ट्रस्ट अस. तभी अपनी फैसिलिटीज जो है वो बेटर होगी. बेटर इंडिया के लिए वी विल गो. ओके. So here are some of the references I have gone for these slides. History of WHO, I got it online. And then Age Friend World Network, Kochi, I got some few shots from there. Then I got one study for health law and bioethics by Professor Helena de Mello regarding the informed consent. It was very nice case study by the Madam Helena. And I referred a textbook of healthcare critical ethics issues, 21st century by Ellen Morrison. So these are few of the references I have gone through. And thank you so much for listening me patiently. And I hope I serve the purpose. Informed consent समझ में आ गया है, all of you. I consider this. And being the backbone of healthcare system, we should facilitate, we should put our efforts. If WHO has launched the theme, it is not like that today we have discussed, tomorrow we forgot. हाँ, एक webinar था, we discussed about my health, my right. When we are consumer, then also we should be, we should be advocate for ourselves. हमें पता होना चाहिए which procedure we are going through, क्या benefit है, क्या risk है. We can go for the second opinion also. And when some patient or client is coming to our healthcare facility, then it is our genuine responsibility to provide all the things related to the informed consent, because you are students, you are practicing in the clinical areas. So whenever you find a chance to involve or to watch the informed consent process, you can apply these things to that, because application is very important. You can't forget the things. Thank you very much once again to all the BIMR fraternity.